I invented this technique as a way of being able to work deeply into the tissues around the spine. Particularly here we're beginning to get down to the levels of the multifidus and the rotaries. Rotatories, rather. Like my Cockney grandmother, who was, I think she was dyslexic, she was also deaf from the age of 2, so she invented her own words for everything. And I grew up not knowing that these weren't part of the English language. I tend to reinvent words quite a lot. And this is the essence of this technique. It's a way of getting around the resistance of the body to deeper pressure, and a way of being able to give deeper pressure without that pressure negatively impacting on your own body as you're giving it. It also, again, combines a compression technique with an element of tissue stretching, but in a completely different way. The two hands work together but do different things. Again, I'll demonstrate the technique in the middle of the spine just for clarity. And we're aiming here for the laminar groove, so just lateral to the spinous processes. Now, the hand that's giving pressure is going to give pressure through the thumb. And the way I normally get students to do this is to support the phalangeal joint against the index finger so they can give pressure without any strain on the thumb. Some people actually find that less comfortable, and it is okay to do it this way with the finger supporting out here, but I normally teach it this way. This is the way I tend to do it myself, because if you're working 8 or 9 hours in the clinic, your thumbs do tend to feel it. And what the pressure-giving thumb does is it does open the door, go into the room, deep pressure into the groove, so it sinks in, and it's going to go in. Ideally, we want to go to the point where we actually feel the spine give a little spring and comes out again. This is more moving towards a yin touch, because you can stay in there a long time. What the other hand does, it's going to create a depression by sliding or gliding the skin over the thumb that's going. So that actually makes a little hollow that the thumb can then sink into without resistance. And the way it does that is you just place, again, use the heel of your hand close, so the two thumbs are almost touching. This is where it gets a little difficult to see exactly what's going on. And what you do, as you sink in, you use the support hand to draw the superficial tissues down over the thumb, and then you just lean in until you come to the end where you're going through the back wall of the room, and then you come back out. And the wonderful thing about this is you can go in really deeply without resistance, without so much discomfort. So we're going to do this, and again we're going to change hands. I think just for consistency, I think we'll do everything for now working down, following the general path, sort of pathway of the meridian. So if I'm on the patient's left side, I'm going to use my left thumb initially to give the pressure, because it's easier to give pressure into the slope of the hill rather than down the slope of the hill where the thumb will tend to slide. And I'm going to start, it's hard to start right up at T1, so we're going to start around about sort of T2, 3 area. And so there we sink in, you can see the hollow being created. We go in, and what I'm really feeling for is that little moment when the spine goes spring and out again. We don't need to go to every single point, we just move down a little way.
So you might skip the odd.
Yeah.
Vertebra.
You could go
All of them.
for all of them, but it would take forever.
Wow. Yeah.
So I tend to just. And very often your thumb will just kind of slip into the ones it needs to go into anyway. And when you reach the watershed of the spine, you swap hands.
And now you're pressing up.
Yeah.
So the principle's always that you're pressing in
Yeah.
towards your
Yeah.
own midline.
Yeah.
Mm.
And that's the thumb. There's the rabbit. The hand is making the hole for the rabbit to go down the hole. Or the jade dragon enters the cave, if you want. You always get this thing with Tai Chi martial arts movements that they always have wonderful names, like Green Dragon extends its claw, and the next movement is open your hands, or something really pedestrian. So you go down the laminar groove. The other line that you can choose for this, I think when we teach this in class we will stick to that line, but just broadening this out, if there's time, this is something you could cover with the students, is to actually choose the articulations of the ribs.
The outer bladder channel.
So essentially you come, it's very much on the pathway of the outer bladder channel, you come lateral to the mass of the Tai Yang tissue, and if you feel around on the ribs you will actually feel that there's another little groove there, and that is the groove where that's the costovertebral articulation. So you would actually then give pressure onto the rib, on its little articulation there. Be a little bit more circumscribed with your pressure. This is a slightly tender area, but this gives a wonderful rib release.
Are you pressing the rib downwards?
Really just
towards the sacrum?
really just straight,
In, just straight in.
straight in, just to give a little tweak
Okay.
to the rib. If a rib was obviously misplaced in one direction or other, then you might well angle it. But so this actually gives you another. I'm working up this time just to confuse you, but.
And when you were working along the waterline before you're just going in, it looked like you were going either up or down, but that's just
not really.
appearance.
Yeah, that's
it's in.
You have got
It's in.
this
Stretching
stretching of the
Yes, you've got
tissue
the fold.
of the fascia happening at the same time. Because it's really quite a complex technique, because you can actually give the pressure and really emphasise the stretch, or you can simply use this as a way, do it lightly, use it as a way of allowing the thumb to go in. But again, perhaps more for you than for what we do with the students, because you have so many attachments of the sacrospinous muscle to the ribs, many lumbar problems. There will be actually involvement of the insertions of the muscle into the ribs. So doing this little rib articulation work here actually really helps with lumbar problems. But I think in class we'll probably stick to this line, but I wanted to show you that as well because it's useful. So just once more, thumb sinks in, the other hand simply draws the tissue over, makes a hollow, and you fall into the hollow. Effortless, almost effortless. So it's certainly a lot easier than those of you who've studied shiatsu than the classic shiatsu pressure, which I do still sometimes use when I'm in a nostalgic mood. But this, if you do more than a few of these and a few clients of these, your thumbs really tell you about it. This helps to protect the thumb. Okay.